Welcome friends, welcome back to my YouTube channel. I am Dr. Vijayan Govinda Gupta. I am a urologist, andrologist and a microsurgeon in New Delhi, India. This video is slightly off topic from my usual videos, which are usually in Hindi. But in this video, I am going to try to explain to my patients who speak English or are from the English speaking world about what is a varicocele, how does varicocele impact them or impact their sexual life, and if they're looking for varicocele surgery to be done in New Delhi, India, then whom to approach, how much would it cost, and what entails getting a varicocele surgery or varicocele treatment in India. So first let me understand, or let me try to make you understand what is a varicocele. So normally we have the testes. In the testes we have three groups of blood vessels. So one is the artery which gets the blood from the heart into the testes. One are the veins which get the blood back from the testes back to the heart. A varicocele is basically dilatation of these veins. So once these veins get dilated, this blood is not able to move back into the heart and there is a stagnation of this blood. This constant pressure plus buildup of metabolites can cause damage to the man's testes, and the damage will present in a number of ways. The most common are reduction in testicular size, reduction in sperm count, inability to father a child, reduce the testosterone levels, inability to have actual good sex, and if left untreated, these varicoceles can usually consume the testes and make them smaller and really impact the man's sexual features and the sexual and testosterone levels and the sperm counts. So the varicocele requires treatments, but at the same time varicocele treatment is a very niche treatment. Very few people are very well versed with how to manage varicoceles, and the treatment protocols usually require a very fine eye to spot who really require treatment and who don't. The first thing that if you have a varicocele that you need to do is to get an ultrasound which will grade the varicocele into the various grades, and maybe get a semen analysis or get your sperm count checked and get your testosterone levels checked. So once you have these three, usually a decision can be made. Newer tests which are emerging for varicocele treatments are DNA sperm fragmentation indexes, which are still under research, which I still do for a few of my patients, and usually those can also document early varicocele changes or early varicocele harms. So if any of these parameters are deranged, and or if you're looking for fathering a child, or if you are having pain or symptoms, or if your testis size is reduced, or if the varicocele is higher grades. So the four indications for surgery would be a high grade varicocele, varicocele making the testes small, a varicocele which is reducing your testosterone or sperm counts, or a varicocele which is causing symptoms like pain on walking and such. So in those cases you would require treatment. Now, treatment of varicocele is of three types. So one would be medication, which usually works only in very early stages and is usually again not a very long-term form of treatment. Second are surgery and embolization. So embolization is basically you put a needle up the man's thigh vein and you go up to the main vein and block it. Embolization is coming up in a big way because it looks easier, it feels easier, but let me tell you, a lot of research says that embolization is not the best way to treat the varicocele. The best way to treat the varicocele is still and will always be microsurgery, the Goldstein's approach, if I may say, in which we make a very small incision at the base of the scrotum. We get those veins out, we identify those veins under the microscope and just tie each of those veins which are causing problems. We don't tie all the veins, we preserve the arteries, we preserve all the important vessels and important parts, and we just go in and tie those problematic veins, and this usually is all that is needed to cure the varicocele. Over a period of 3 to 4 months, the body absorbs these veins back, makes them thin again, the blood circulation improves, and patients can notice a significant improvement in their testis size, in the testosterone levels, and in the sperm count. So varicocele surgery is a daycare surgery, usually done. The surgery lasts for maybe 45 minutes to an hour. The patient needs to be in the hospital for a day. I usually do not put any catheters or do not give the patient a lot of discomfort. We usually do it under spinal anesthesia. The patients can usually walk about 3 to 4 hours after the surgery, and it rarely causes any complications. The few complications that are maybe a bit of bruising, a bit of pain, but that's rare. So microsurgical varicocele repair is actually a painless method to treat varicocele, which requires very little effort and time from the patient's part. If you are planning to get your varicocele surgery done in India, you need to be in India for a week for your testing, for your surgery, and then you can usually fly back to your country from where you came. The treatment costs are much less than getting them in Europe or in the US. So our treatment rates are usually 1/10 of what you are going to be paying, with results which are as good as anywhere in the world. To get a genuine varicocele repair in India cost or a quote, you can always contact me on my email, on my Facebook page, on my WhatsApp, and my team will get back to you with a accurate quote depending upon your requirements. Thank you for listening in, and if you really like this video, please comment on it, like it, subscribe it, press the bell icon, or you can always share it with other friends who you think would require varicocele treatment down the line. Thank you so much for staying tuned. Thank you.